And I look at health coverage and I look at is this something that needs to be provided as a service, not as a private industry, which is requiring people to buy insurance, which is enriching the insurance companies at the expense of young people in their 20s and 30s and 40s that probably don't get sick very often, especially the 20-year-olds or 26-year-olds and up to 30-some-year-olds. And so it's enriching the insurance company, which is basically subsidizing the older people who are more in demand or have a greater demand for health coverage or for health services. And so I look at this, and I know a single mother that's a realtor, and she shared with me that she has to pay something like $800 a month for her health insurance plan for her and her daughters, 2 daughters, and they can't even afford to go to the doctor when they're sick. Why? Because they have like a $1,600 deductible. So when they're sick, they just tough it out. They, snivel and cough and have a runny nose for a couple weeks and drink or eat chicken noodle soup and try to drink some teas or whatever, try to mend themselves. But that insurance is only there if they need like a major surgery, a hysterectomy, or some other major surgery. And so that is enriching who? That's enriching the corporate insurance companies. And it's a wealth transfer. Now, whether the Republicans want to admit it, and I know they like to accuse the Democrats of taking from the haves and giving to the have-nots, and they like to keep that class envy going, that class warfare going, of the haves, the have-nots, people that's paying into the system and people that's living off the system. But at the same time, there is wealth distribution or wealth transfer that the Republicans support, and that is the person that has to buy that insurance is taking money from them to enrich the CEOs or those corporations of the big medical establishment, the medical industrial establishment. And also, I look at it that if you are a senior, you retire and maybe through your good fortune, you were able to retire with, say, $500,000, maybe $1 million. But what happens when your spouse has to be in the hospital for 2 or 3 months and go through rehab and have to have bypass surgery and this surgery and that surgery? And that nest egg that you saved, that you worked so hard for, is transferred from your savings account into the account of the hospitals, the healthcare provider, as well as the big pharmaceuticals and the medications that you'll be on for the rest of your life. So what I would propose, and I know that this might chap some of my libertarian friends, because one of my philosophy is small government, laissez-faire, hands-off, free market capitalist system. Competition, competing will drive down the prices, but we don't have that in America. Or second of all, let the states provide it, similar to what Mitt Romney as governor did up in Massachusetts. Okay, if the states want to provide that for their people, as long as they pay for it, go at it. And if you want to live in a state that has health coverage for its citizens, then you can live in one of those states or work to get state legislators elected to your state capital so that they can provide this state health coverage plan for everybody. But we don't have 10th Amendment rights too much anymore. And besides that, states are bankrupt themselves along with the federal government. So what's the solution? Well, I believe that we need to look at and have some really good dialogue on looking at health coverage for our citizens. By the way, Mr. Taxpayer, and I know some of you are just going to write me off because you're saying, oh, I'm not going to pay for those people that are going to abuse it. Well, I understand there's abuse in any system. I know that there are people that will abuse any program that's out there. But let me say this, you're paying for it already if you're working and paying taxes. You're paying for Medicaid. and you're paying for the other people that walk into emergency rooms, and some aren't even U.S. citizens, that those hospitals are forced to provide for. And no doubt, I don't think anybody would want to see anybody lose their life or die. But that's another debate as far as illegal immigration. But you're paid for already. And I look at it that it's kind of like fire protection or fire departments. Years gone by, probably 100 years ago, 150 years ago, when cities started becoming just growing with industry, that what happened was you had fire companies that if your house was on fire and you paid into that fire company, kind of like an insurance company, then they would come and put your fire out. But the problem was that while your fire was burning, and you'd have a placard over your porch to let that fire company know that you're their customer, then what would happen is that while your house was burning and your fire company was there fighting your fire, that your next door neighbor's house would get on fire, but they didn't belong to the same fire company, fire services, and so they would have to wait till their fire company came, and it just presented a big problem until they started looking at it that maybe this is a service that needs to be provided by the community, the local city level, municipality, that if your house is on fire, we're going to have a fire department made up of volunteers, and some bigger cities has full-time employees. And I think that might be what we need to look at as far as health coverage. We are an industrial society, and it is sad when we have so many people that are dying, so many people that are being bankrupt because of sickness, because the money they did have or the insurance they did have, the insurance company says we're not paying for that because that may be a pre-existing condition, and all this baloney. That there's stories out there. Just listen to NPR radio, turn off the network radio, and listen to some of these stories. They're heart-wrenching about families that are being bankrupt because of sicknesses, people that are dying because they weren't able to get be able to catch a sickness in time to get proper treatment, so it's out of control like a cancer, and people die that could have been treated if they felt like they could have went to the doctor and got treatment if they could afford it. And so I look at health coverage, and by the way, I believe that there are four enemies of mankind. One is ignorance, the other is disease, the other is poverty, and the other is war. And I'm against all four of those. I'm against ignorance. Now, do I believe in public education? Well, yeah, I believe that people need to be educated. Now, who controls public education is something that we could talk about, because I think that getting it down to the local level or to the state level or district level is better, because you have professional superintendents, administrators, school board members that want to provide a good education for their children. So that's another subject, but that's something that we pay into. And do I have children in public education? No, my kids are graduated, and then we sent them to a private school. And there's some people that pay or homeschool and other things. They still pay the public education. I didn't go around begrudging that fact. No, it was a sacrifice that my wife and I made for our children to put them in a private school, and we believe that it was a good decision on our part. My dad was a public educator. He was a public school teacher. I went to public school. But that's a service that we feel that it's important to provide to our children. And so is health coverage important to provide to our citizens? I think we need to look at it, that it's a service. You say, oh, you're just a big government. No, I'm not. But what we have now is a big government that's out of control, and it's not being run properly. And by the way, our founding fathers, and we don't talk about the Constitution, but our founding fathers gave us the U.S. Postal Service. And I know some of you want to privatize that because it can't make a profit. And the reason why maybe it can't make a profit, and if I'm elected, I'll find out the real reason, but it's not necessarily because of that Postmaster General who goes to Congress and he says, tell me what we need to do. But it's Congress that's dropping the ball. Because they believe in this free, or they believe not in free market, but they believe in privatizing everything so that what? You're going to enrich the few, the person that has that service. And besides that, we have a postal system, and we still have at least two that I know of, UPS and FedEx, that provides overnight or second day air letter service. And could you imagine if we privatized the Postal Service? That envelope or that letter, first class mail, would go from 45 cents to $4.50, if not more, maybe $20, to get that letter from New York to California. And I don't think anybody can pay for it that way. So it's a service, because our founding fathers believed that communication needed to be provided so people can share their ideas and their knowledge with each other and what's going on in their lives. And so 200 some years later, 237 years, I think, since the Revolutionary War began, but 200 some years later, here we are at a crisis in America.